Everyone, welcome to researchmd.com. Another great presentation. Today we're going to teach you about high yield clinical concept in cardiology. It will help you any test you take, USMLE, internal medicine, family medicine board, or nursing, or all these things. Plus, it's also good to know some of those things in the daily clinical practice. Going to be very, very useful. Okay? My name is Dr. PRAMIL. So let's start our clinical scenario. So we got a 60-year-old gentleman diagnosed with unstable angina. What did he go? He go for like a cardiac cath. And now, once they do the cardiac catheterization, we have this finding: 80% proximal LAD, high-grade left to main stem stenosis. Okay. The question is going to be, what is the answer? Like, what do you recommend to the patient? See, what is the most common? The main concept is we're going to look at what are the most common wrong answer people get it. Okay, that's the way we can better understand. They'll remember more. So the main concept: what is the most common wrong answer? Percutaneous intervention of coronary artery, PCI or drug, eluting stent. Okay. So this answer is wrong. Don't pick it. But most people usually pick this answer and you get it wrong. Okay? So what is now the next thing is, let's look at the heart and identify where our main lesions are. Here, you got the left main coronary artery, then the left circumflex comes out of it, and then we have the left anterior descending artery, then you got the diagonal artery, right main coronary artery. So we got a lesion in the left main coronary artery up here, and the lesion in the LAD. Okay? Now, we made this huge diagram over here. Okay? So let's look at the heading. So, we have a blockage. Do we do cabbage or do we prefer stent? Okay. So no risk, diabetes, or left ventricular dysfunction. That means ejection fraction less than 35%. Okay. No risk, diabetes, and left ventricular dysfunction less than 35%. So one vessel disease, you can do a stent. Okay. Then you have proximal LAD. That's really bad. Then you need to do cabbage. Okay. You cannot do a stent in this group. So this patient already have an 80% proximal LAD lesion. Now, you got two vessel without LAD, you can get away with a stent. Okay, cabbage is not needed. When you have two vessel with LAD, you can do cabbage and or you can do a stent. Depends upon the clinical situation. Okay, and then you have two vessel proximal LAD, you do only cabbage. You cannot do a stent in those people, okay? And then you have three vessel disease. The data is not clear. Either, you can do a cabbage or a stent. The data is still not very clear. And when you have three vessel and proximal LAD, you do cabbage. You cannot do stent, okay? Then you have left to main stem. Like in this patient, you have to do cabbage, no stent. Okay, that's in a nutshell kind of tell you. So mainly be careful. When you have proximal LAD and left to main stem disease, your options kind of limited. You have to go for cabbage. And then you have some other indications right here, right? Two vessel with the LAD and two vessel with the proximal LAD, three vessel disease with the proximal LAD, and all of the other indications. Okay? So just remember, don't pick this wrong answer, PCI. That's what everybody usually picks it. That is the wrong answer. Okay, you have to know the difference between when do you do cabbage and when do you PCI. Thank you so much for watching. God bless.